So my name is Todd Florin. I'm a senior fellow in pediatric emergency medicine at the Children's Hospital of Philadelphia and an instructor in pediatrics at the Perelman School of Medicine at the University of Pennsylvania. So I went to medical school at the University of Rochester, upstate Rochester, New York, and then came to Children's Hospital of Philadelphia for residency in 2005. I started my residency here and was chief resident here in 2008 to 2009, and am now in my final year of fellowship in pediatric emergency medicine here at CHOP. One of the things that drew me to pediatrics was that it offers such an extreme variety in your day-to-day activities. I get to spend a day taking care of a 2-day-old who's just been born, all the way up through adults who have pediatric problems that have lingered into adulthood. So that kind of variety, the fact that I can see all these different types of patients and all these different types of problems in a single day, really attracted me to this field. And pediatric emergency medicine in particular, the ER offers really a first-hand glimpse into what is going on in our community. So if there's H1N1 influenza in the community, we are oftentimes the first clinicians to see that surge, to see that disease process happening. And it's really exciting to be able to have really your finger on the pulse of the health of the community that you serve. Netter's Pediatrics has really been, for all of us involved, a labor of love. And fundamentally, this book has been about teaching and about mentorship. Frank Netter, the artwork of Frank Netter has meant so much to all of us who go into medicine, starting from the very beginning with Netter's Atlas of Anatomy, that almost all of us in medical training use to learn gross anatomy during that first month to year of medical school. So when Dr. Ludwig and I were thinking about how we were going to structure the book and what the book was going to look like, we thought this should definitely be about mentorship and about medical education, because that was what Frank Netter was all about, and that's what Frank Netter's art meant to all of us. So the way that we constructed the book was we sought out involvement of trainees and young faculty members to act as lead authors in the book. So every chapter every chapter was written primarily by a CHOP resident, fellow, or junior faculty member, and then each section of the book was edited by a CHOP senior faculty member who specializes in that field. So it really allowed the mentorship process to unfold between these young trainees and these more experienced senior clinicians and teachers. When we think about how a lot of us in medicine learn, some people learn by reading a lot of text, some people learn by looking at a lot of pictures. I would say for the majority of us, it's learning by the mixture of text and pictures, and oftentimes as visual learners it is so helpful to have actual pictures, actual visuals in front of you that help to reinforce the text that you are reading. And that is what makes Netter's Pediatrics unique in this marketplace, is its ability to really focus on the visual learners without being stingy on the text, so to speak. We give detailed text and detailed information about each disease process while also appealing to the visual learner. Netter's Pediatrics is written in such a way that it is very concise. It hits all of the major points in a very readable format, and the pictures enhance that quick, concise text that you're going to find. So for medical students and residents, those who are learning pediatrics for the first time maybe, this textbook is perfect to be able to absorb all of the key concepts to understand pediatric disease. For those practitioners in the office, pediatricians, physician's assistants, nurse practitioners, this book actually offers a chance not only for them to refer to themselves to better understand pediatric disease, but to also share with their patients and with their patients' parents to show the visuals of what exactly is going on when your child has otitis media. The practitioner can very easily turn to the otitis media chapter, show the parents a picture of a tympanic membrane that is inflamed and red and purulent, and say, this is what is going on, to help a parent understand something visually that they may not be able to see themselves. I think medical education right now is really moving, or has moved, from sitting in a classroom and listening to lectures and reading books and taking tests to that of real experiential learning. And for me, that is, as a teacher and a student at the same time, experiential learning is what it's all about. So I take particular interest in visual diagnosis and in simulation-based practice, basically helping learners to really experience what it feels like to really take care of patients, to then be able to apply those concepts when they really do stand in front of a patient and have to make a diagnosis and a treatment plan. So part of experiential learning is actually being able to use all of your senses to absorb a concept. And one of the things that I particularly like about Netter's Pediatrics is it helps you to use that sense of sight and that visual stimulus to experience the disease process that you're reading about. And so I think that this book fits into that trend that we're seeing now more and more in medical education of experiential learning, making the material relevant, real, and present for the learner. So Netter's Pediatrics was truly a collaborative effort of a lot of different physicians here at the Children's Hospital of Philadelphia. There were over 100 contributors to this book from all different specialties across all different divisions in this institution. And so it really took a lot of effort to bring everyone together to produce this volume. But I would say that during the course of putting this together, everyone at the institution who was involved was very excited about this concept, very excited about bringing the art of Frank Netter and his proteges to life with text, and very excited about sharing the material that they are so passionate about with the general public in the form of this book. So with over 100 authors and editors, this really demonstrated the teamwork of the physicians here at CHOP. Working with the editors and the artists at Elsevier has been an incredibly easy, stimulating, and collegial process. And for that, I think choosing Elsevier was an easy choice.